So thank you. I want to welcome everyone to the Recognition of Excellence Awards ceremony for the 36th Annual CANO Conference, From Coast to Coast, Uniting Our Practice. Today, we gather to celebrate the remarkable contributions of oncology nurses across the country whose unwavering commitment to patient care and advocacy continues to inspire us all. As we look around the room, we see an amazing tapestry of talent, compassion, resilience, woven together by our shared dedication to nursing. Whether you hail from a bustling urban center or serene rural communities, your work transcends geographic borders, bringing healing and coping to countless lives. So each nominee has demonstrated outstanding clinical skills, innovation in practice, and profound impact on their patients and communities. You remind us that nursing is not just a job, it's a calling that requires courage, compassion, and unwavering commitment to lifelong learning. We would like to thank our sponsors for the awards this year, which is Boehringer Ingelheim, Amgen, BD, Pfizer, Kidney Cancer, Merrick, and of course CANO. So thank you to all of our sponsors over here at the far right table. I would like to say that we don't take these sponsors for granted, and we are appreciative of their resources each and every single year. Thank you to all of you who have nominated amazing nurses, and we wish we could choose all of them, and every year it gets harder and harder. And it's so amazing to see all of the different nominations that we receive each year from across the country. I'd like to thank our ROE committee members, Katrina, our incoming president, Nanette, who will be joining me up here later, Carolyn and Jean and Leah and Charlotte. So thank you for all of your support this year. And of course, Ernest, who is my partner in crime, more of the crime partner though, but I really appreciate everything that you've done for us this year to keep us on track, as we wouldn't have been able to do it without you. So this year, I want to start off with the CANO Travel Grants, and we're very fortunate from the CANO board that we have 8 grants of $1,000 that are awarded each year to help nurses attend the conference. Are they going to post the names? No? No? Okay, that's okay. If you haven't picked up your travel grant, please go see Ernest. For the, oh, there they are, great. For the graduate student travel grants, you'll see that there's there's several $1,000 grants for nurses in graduate studies, and they're allotted to help graduate students attend the conference. And then of course, undergraduate students, it's the same thing. There's $1,000 grants for nurses in undergraduate studies that are allotted to help attend the conference. So please consider applying for some of these next year, as there's always some money available for those needing to attend the conference. And the next award is the Marie Marquis Memorial Scholarship for CNA certification. So the Marie Marquis Memorial Scholarship Award's purpose is to encourage oncology nurses to pursue their CONC or their CHPCN certification. These scholarships were renamed from the CANO ASIO Scholarships for CNA certification in honor of Marie Marquis, who was the program lead for the CNA Credentialing Center, who passed away unexpectedly in 2022. So this year's 2 recipients are Sarah Lace from Nova Scotia and Alma Perez. And Alma Perez from the Odette Cancer Center in Sunnybrook. Do you want to come over here? The next award is the Dr. Tracy Truant Memorial Scholarship. The Dr. Tracy Truant Memorial Scholarship is awarded annually to a CANO ASIO member in good standing who is pursuing doctoral studies in nursing or another field relevant to cancer care. The recipient will be an individual who reflects characteristics that Tracy exemplified, including active in oncology initiatives, displays excellent leadership skills or leadership potential, and builds oncology nursing capacity nationally and internationally. And for those that aren't aware, that Dr. Tracy Truant passed away, and so this scholarship is in memory of her. She was a very important, active member of CANO, and we truly remember her each and every year during this award. So this year's award winner is Kylie Taggart. I just want to say something briefly. Kylie is currently a part-time instructor, graduate program School of Nursing, McMaster University, and she's currently pursuing her PhD at McMaster in Hamilton. She's a very engaged CANO member and active within the Horseshoe chapter events, and serves as the chair of the CANO ASIO Doctoral Student Network, a member of the Hematology BMT Special Interest Group. She's also been recognized as the Jervinsky Cancer Program in Hamilton through the 2020 On4 Oncology Nursing Chapter Champion. And she volunteers at the Wellwood Cancer Support Center and a nonprofit community resource. And also her colleagues have described her as committed to developing skills and practicing as an oncology nursing leader in Canada, and an outstanding oncology nurse who will provide legacy impact on oncology nursing. So congratulations, Kylie. Now I'd like to call up another partner in crime, Nanette Cox, so that she can share some of the duties.
Hi, I'm Nan Cox-Kennett, member of this fabulous committee, and if you ever want to be on a committee, this is the one to do, because you get to do all the good, fabulous stuff. I've been blessed to be honored and receive some of these awards, and so it's really nice to be able to give back. The first award that I'll be mentioning is the Nursing Scholarships. So the purpose is to encourage oncology nurses to pursue university education to enhance nursing knowledge and development in the field of cancer care. And our first scholarship goes to Sarah Quinn. And our second one goes to Gabrielle Wong-Ken. I invite you to step up to the side. So Sarah is pursuing their MSN at the University of Victoria, very active CANO member for several years and joined as an undergraduate student, and is also active for CANO Alberta South Chapter and organizing oncology events. Sarah is an abstract reviewer for CANO and has presented and is participating in research in cancer care over the past several years. Gabriella is pursuing her MN at the Athabasca University and joined CANO as an undergraduate. She's very active in research and has co-authored a publication in Conj already about the workshop for CANO, and was a panelist at the Canadian Cancer Society and ACIO Joint Symposium on Advancing Equity at the 2023 CANO Conference. You go ahead. I'm going to make Reina do all the pictures so that I don't have to walk back and forth. I've got a leg injury, and so walking really hurts. And so I've asked Reina to help me out. Our next award is supported by Amgen, and I'd just like our Amgen representative, Do Miata, to come up to the stage. So this is an award for innovation in oncology patient and family education, sponsored by Amgen, recognizing nurses whose primary function is patient and family care and who have demonstrated creativity in the development of patient education materials, programs, or the delivery of patient education. And our recipient is Cassie Nguyen. Cassie is an advanced practice nurse for the medical and radiation oncology patient unit at Sunnybrook. She recently did a project that would help to educate nurses, families, and other healthcare professionals to ensure that there are different guidelines and assessment requirements for patients with glioblastoma. Her peers say she continues to think outside the box and examines healthcare systems and policies to ensure these patients are represented fairly within the falls risk and patient observer policies. Congratulations. Our next award is the BD Commitment to Safety Award, and I'd like to ask our representative, Tanya Marvaki, to come up. This award is sponsored by BD and recognizes the outstanding work of an oncology nurse who is committed to patient and healthcare worker safety, and our award recipient is Stephanie Claremont. Stephanie is an RN at the Ottawa Hospital and has performed a QI project on chemotherapy unit. Through her innovative project, it was aimed at mitigating the risks for error associated with high alert medications. As an experienced and astute chemotherapy nurse, she felt that there could be a reduction in errors if we enhance safety checks through pump programming, security connections, and tubing selection. And although it's recognized that this was not new practice, these issues, as we all know, arise daily. Stephanie went above and beyond in her role and demonstrated dedication to oncology unit as an RN. Thank you, Stephanie. Our next award is the Kidney Cancer Award, and I'd like to ask our representative, Christine Collins, to step up. So this award is in honor of the Kidney Cancer Canada founder, Tony Clark, and recognizes an individual or group who have made an exceptional difference in the lives of kidney cancer patients. Tony was diagnosed with kidney cancer in 2004, and throughout his cancer journey, he focused on living life and advocating for educational resources and support for other kidney cancer patients and their caregivers. Our recipient today is Tevi Holling-Nergard from Calgary. Tevi is the longest serving kidney cancer clinical trials nurse at the Tom Baker Cancer Centre since 2007. Tevi's been part of the genitourinary tumor group, including kidney cancer, and has been described as paying enormous respect for her kidney patients, forming relationships with them to guide them through their cancer journey. She's also a leader within the clinical research nurse team, and her peers describe her as continuously pursuing excellence. You'll also get to see her next year. She's a co-chair for Banff, Alberta, CANO. Congratulations, Tevi. Our next awards are from Pfizer. I'd like to invite Martine Ranger up as our representative from Pfizer. There's a group of awards here that are sponsored by Pfizer, and our first one is an award for clinical practice. And our Pfizer award for clinical practice goes to April Boychuk. Tevi, I have a note here that maybe you're accepting on behalf of April. April is a nurse navigator in the adult AYA and adolescent program and supportive care team at the Tom Baker Cancer Centre, and has made the program one across Canada that others look to for guidance. One of April's patients created a YouTube video entitled Sarah's Story, A Guiding Hand. And if you ever have a minute to watch this very emotional video, I encourage you to do so. Our next award is the Pfizer Award of Excellence in Nursing Education, and our recipient is Andrea Knox. Andrea is a clinical nurse educator and senior practice leader, and now the Director of Nursing and Allied Health Research and Knowledge Translation at BC Cancer. She's also the immediate past president of the BC chapter of CANO SEO, holding that position for 11 years. While she was president, she mentored and taught new nurses in the chapter alongside her 3-year term as the director at large here for CANO and the board of directors. And she's been described as representing oncology nurses at the regional, provincial, and national levels. Thank you. So everybody's got such big smiles. So fun. Our next award is for an excellence in research. And our recipient is Edith Petuskin. Is she here? Yes, she is. Edie is an RN since 1985 and assistant professor at the Faculty of Nursing, University of Alberta. Over 20 years, she has worked in medical and radiation oncology at the Cross Cancer Institute as a nurse practitioner and as a leader in cardiac care for cancer patients. She's been awarded a prestigious Canada Research Chair in Nursing for her ongoing research to improve the health outcomes of cancer survivors. And she was recently awarded funding called the Precision Human Health Lab by the Canadian Foundation for Innovation and Alberta Technology and Innovation. Our fourth Excellence Award is in Leadership, and our recipient is Jean Ann Ryan. Jean Ann is a lymphedema nurse coordinator leading the multidisciplinary oncology team to provide lymphedema services, ranging from education to intensive therapy to home-based management. Jean Ann works at the community and provincial levels, and her role as project lead for the very important Journey Across the Island project. With this project, she led the establishment of partnership with NL Indigenous populations, the Cancer Program, Memorial University academic partners, and inclusions, as well as the Canadian Partnership Against Cancer. Her colleagues say that Jean Ann has spearheaded several key initiatives that have greatly improved patient care. Congratulations. Our next big deal award is the Rising Star Award. So this is a novice oncology nurse, somebody who has less than 3 years in oncology nursing, and in this short time frame has made local, regional, or national contributions to the profession of oncology. Our recipient this year is Claire Fullerton. In the short time since Claire has graduated, she's worked locally with colleagues on the Planetary Health Waste Reduction Project and the oncology floor at Island Health. In conjunction with this work, she co-founded and co-chairs the CANO ASIO Planetary Health Special Interest Group. She's deployed in the Canadian military to Poland to train Ukrainian medics, and yet during this time, she's still connecting with oncology groups in the area and has brought forward requests to CANO to support these groups, and we think you're amazing. Thank you, Claire. Next big deal award is the CANO Award of Distinction. This is given to an RN who over their career has made a significant impact, is innovative, and whose contribution to cancer nursing, education, leadership, or research has furthered the visions and missions and values of CANO ASIO. Our recipient is Diana Insikol. From Princess Margaret Hospital, Diana has been a nurse since 1994, in oncology since 1997, in oncology since 2006, and a long-standing CANO member. She's on countless committees, advisory boards, and has implemented many projects in systemic therapy and consulted to other hospitals, paramedic programs regarding IV therapy. She's developed and implemented courses for D'Souza and oncology courses nationally and internationally, including Qatar and Kuwait. Diana also developed oral chemotherapy for Latin American nurses study modules for the International Society of Nurses in Cancer Care. She's been described as an experienced and influential oncology nurse leader. Congratulations, Diana. And the last one I get to do is the Lifetime Achievement Award. Pretty much self-explanatory, but it's a way of acknowledging and outstanding the achievement of Canadian oncology nurses, and the purpose is to acknowledge the contribution to the development of oncology nursing in Canada, a lasting contribution, a lasting legacy of impact. The award is provided to a nurse who's made that contribution throughout their lifetime and their professional career. And our recipient goes to Gail Larocque. Gail has been an RN for over 30 years and is currently a nurse practitioner in oncology for the Wellness Beyond Cancer program at Ottawa Hospital. Over the last decade, Gail has helped to lead the implementation of this program and helped cancer survivorships for patients with breast, colorectal, and endometrial cancer. She's been part of the CCO Survivorship Committee at the provincial level and also been part of numerous research studies at the Ottawa Hospital to improve care through innovation. She's been described as a trailblazer and a pioneer in the development of the survivorship programs, working tirelessly to advance care at both clinical and research levels. We've got a couple minutes. So.
Okay, thanks, Annette. Thanks. I'm going to have to use my notes, particularly after that. I want to start by thanking the CANO Board of Directors for this award. I was genuinely taken aback by the email informing me of this, and it truly is an incredible honor to be nominated by your peers. I'd like to acknowledge all the past winners of this award. It is a group that I'm not only humbled by, but honored to be part of. My nursing career didn't start in oncology. I started in a critical care unit at St. Michael's Hospital in Toronto. And when I was contemplating my changes in terms of my career, my classmate and dear friend Jan Stewart suggested that I come to Princess Margaret Hospital. And suffice it to say, I can't thank her enough for encouraging me to consider this. It has had a huge, huge impact on my career. I started out on the IV team, exposed to a multitude of disease sites and to the impact of treatment on patients and their families. I transitioned to the clinical trials unit with the medical breast group. Doctors Fine, Boyd, and Tannick taught me about the value of clinical research, critical thinking, and I believe they set the foundation for me and my beliefs in evidence-based care. Princess Margaret is also where I met my first oncology MP. For nearly 30 years, my friend and mentor, Laurie Martel, has encouraged me not only to pursue my goal of becoming an NP, but also my return to oncology. Paula Deering, Kathy DeGrasse, Drs. Roanne Siegel and Tim Asmus, thank you for giving me the opportunity to become part of the Ottawa Hospital Survivorship Program at its inception. I thank them and the whole team at the Ottawa Hospital Cancer Centre for trusting me to demonstrate what an NP could bring to the team and to patient care. It has been one of the most rewarding parts of my career. Although I can't mention everyone, I want to thank Kellyanne Baines, Vicki Samuel, and Carrie Liska. You are the most incredible colleagues and friends. You inspired me to do my best every day. And last but not least, I want to acknowledge my husband, family, and friends for their unwavering support over the years in this journey. I couldn't have done it without any of them. Thank you again for this incredible honor.
I'd now like to invite Mark Fitch up to do the rest of our awards. She's the Conj Editor-in-Chief. Mark's here, yes.
Thank you very much. I'm going to do the awards from the journal perspective, and then other colleagues will take over from there. From the journal perspective, we have 2 awards that we provide. One is for the best manuscript, and one is for a top-notch reviewer. So the manuscripts we look for are manuscripts that are not only of a high quality, but also ones that have relevance to clinical practice. And the award itself was set out in honor of Heather Porter, who was my predecessor as editor-in-chief. And she always had a strong sense that the journal needed to translate knowledge for clinical practice. So the award for excellence in reviewing is actually given to someone who reviews our manuscripts, and that's a very important process because the quality of our manuscripts is a result of whether the reviewers have seen that they are actually well written, they are appropriate in terms of the kinds of methods, the kinds of knowledge that is actually communicated. So the award for reviewing peer-reviewed manuscripts this year goes to Anita Long. And I will say that Anita is in Toronto at the Sunnybrook Health Science Centre, and she never says no when I ask her to review a manuscript. And she's responsive in terms of sending the report back, and it's always constructive criticism for the authors. So now I'm going to make the walk over. Now, the manuscripts are actually selected by the members of our editorial board. We have a rating system, and as a result of that rating system this year, we ended up with 2 best manuscripts. And interestingly enough, they were both about navigation. And one focused on a systematic review, looking at all of the literature available around navigation and the nursing role. And the other is about navigation with our Indigenous communities. So I am very pleased to invite our 2 winners, Jessica Katarinchuk from Alberta and Carolyn Roberts from Quebec. And at this point, I will invite Samantha to come and give the research awards.
Hi, everyone. Great to see everyone here this morning. My name is Samantha Mayo, and I have the great privilege of acting as the Scientific Review Panel Chair for the CANO ACO Research Awards. So these awards are research grants for which the goal is to support oncology nurses in conducting and disseminating a clinical research project that contributes to evidence-informed oncology nursing practice. The continued funding of such grants demonstrates how much the Board of Directors, in conjunction with the Research Committee, is really committed to supporting oncology nurse engagement in research and scholarship. Submissions are reviewed by a panel of oncology nurses with relevant clinical and research expertise. And before I announce the awards, I'd love to really recognize and offer my gratitude to those of you who reviewed these grants that ended up with our results for today. So I'm very pleased that we were able to award 4 recipients with these grants this year. I will talk about all of them, and then we can take some photos. So the first awardee is Amina Silva for the project of supporting breast cancer survivors beyond treatment, a scoping review. Argan Malakian, exploring the experiences and supportive care needs of adults with relapsed or refractory acute leukemia. Verna Chung, for evaluating a structured multi-component exercise program's impact to symptom burden for patients with myeloproliferative neoplasm. And Rayanne Carter, for understanding the supportive care needs of young individuals with gynecological cancer after the implementation of the Indigo Clinic at Sunnybrook Health Sciences Center. Congratulations to all our recipients. And I'll invite them to come up to take some photos.
Ernest, we're on time. So this is the last and final award for this year's 2024 Recognition of Excellence Committee Awards, and it is the Nurse of the Year Award, which is always dear to my heart. So I would like to call Boehringer Ingelheim Representative Barbara Burgess up to the stage. Barbara? She's the Senior Brand Manager, and she's going to be presenting the Nurse of the Year Award. So the Boehringer Ingelheim Nurse of the Year Award recognizes an oncology nurse who demonstrates passion and possesses the qualities needed in leadership and teamwork, who demonstrates oncology nursing excellence, leadership, and contributions to advancing oncology nursing and/or health systems transformation. And so the nominees are up on the screen. And Barbara's going to just talk a little bit more about the Nurse of the Year Award from the Boehringer Ingelheim perspective. Thank you, Barbara.
So on behalf of Boehringer Ingelheim, I'd firstly like to express my gratitude to all of you for the incredible work you do supporting cancer patients along their treatment and recovery journey. Boehringer Ingelheim is deeply committed to the field of oncology. Oncology is one of the cornerstones of our research portfolio, and we're focused on finding new treatment options for patients, especially in rare cancers. Since 2010, we've been proud to support the Oncology Nurse of the Year Award, which recognizes outstanding contributions to your peers across Canada. So congratulations to all the nominees and the award recipients today. Thank you.
And this year's winner is Mackenzie Jansen. Mackenzie has been described as an exceptional in clinical practice, leadership, initiatives, and patient care. Her passion for AYA research and her proactive engagement in initiatives such as the James Lind Alliance AYA Cancer Priority Setting Partnership underscores her dedication to advancing knowledge and improving outcomes for AYA patients affected by cancer. Mackenzie's peers describe her as having displayed an unparalleled commitment to elevating the quality of care and support available to this particularly vulnerable patient demographics. She is playing a pivotal role in shaping and delineating Cancer Care Manitoba's multidisciplinary AYA program development. So congratulations, Mackenzie.
So I had a speech prepared, but if anybody came to my presentation yesterday, I'm going to wing it. Thank you, CANO and the board of directors for this, and for the selection committee. I'm overwhelmed. It's a very full circle moment for me. At 17, I was an AYA patient, and I will account for all the nurses that looked after me, that gave me that tailored special care. The chemo, the radiation, that cured my cancer, but the oncology nurses that looked after me saved my life. My journey to get to oncology was one where I thought I would never get here. There was a lot of healing that needed to happen, a lot of finding myself. I loved what I did. I was a labor and delivery nurse for many years, and I could catch a baby and bring joy into the world, and I loved it. My life changed after losing an uncle to lymphoma who I cared deeply for, and who told me that it's lovely to bring babies into this world and bring joy and happiness, but I was in the wrong place, and I needed to care for those that were just like him. So I applied that day. And I haven't looked back. I joined CANO a month after I got my job, and I don't know if any of you remember me at Princess Margaret, or not Princess Margaret, at PEI. I was just a meek little oncology nurse that was like, what are MABs, and what are MIBs, and what am I doing? But I felt truly at home, watching all of you come together and learn from each other and inspire each other just inspired me to do more and more and more. My best friend, Allison Weens, gently pushed me to get my master's, which I officially graduate in November. And I happened to land on my dream job, working with our adolescent and young adults at Cancer Care Manitoba, doing exactly what the nurses looking after me were doing to help me along. So I'm grateful for my family, who kind of just let me do my thing. I'm grateful for my colleagues and my friends. I'm grateful for this body of nurses that just daily inspire me to just keep going on and push into more. Getting an award like this is, I think it's a lifetime award for me, because I don't think I could really even stand in the places of those ahead of me. So thank you very much. I'm honored.
That was amazing. So thank you everyone for attending our amazing ceremony this year. Today we honored not only individual excellence, but also the collective spirit that drives our profession forward, and we should all be very proud of that. As we celebrate our outstanding nurses, let us also remember the importance of unity in our practice. So together we can break down our silos, share knowledge, foster a culture of collaboration that enhances the quality of care we provide. By standing together, we strengthen our profession and ensure that all of our voices are heard and all of our experiences are valued. Thank you for being here today to honor our extraordinary colleagues, and let us celebrate their achievements and reaffirm our commitment to each other as we continue our journey of excellence in nursing from coast to coast. So we'll see you all in Banff next year. Thank you.